And welcome to Vax Talks. I'm Brad Satin, and we're joined today by Dr. Rakesh Dixit. He is the president and CSO of Regio Biosciences. Thanks so much for joining us.
Thank you.
So, of course, all eyes right now are on COVID-19 and the vaccines becoming available. As we know, there are going to be people out there who are hesitant to get one. So I guess the first question is, should they be?
There is no reason to be hesitant to take this vaccine, especially the one just got approved yesterday by the advisory committee, and then likelihood it will get approved by FDA as well. And I will tell you why. I attended the advisory committee meeting yesterday, and the data I have seen on safety, it looks as good as it gets, in my opinion, for any vaccine. And the reason I'm bringing this up to you that most vaccine-treated volunteers, they develop largely maybe a little muscle pain after getting the injection, very acutely. Some may have a little bit tiredness. Some show vivid fever. Something similar to get like mild flu infection. But it didn't last more than 24, 48 hours. They all got better. And there is no systemic toxicity. There is no organ system involvement that you're seeing liver damage or heart damage or somebody's spinal cord is getting all beaten up. So you're not seeing any of that. And the efficacy is unbelievable. 97, 95% people, those who got the vaccine, they didn't develop any COVID-19. There was no COVID-19 exposure. There were no COVID-19 related sickness, illness, and compared to those who got really sick in the placebo group, this group was much, much better. So it's unlikely, in my opinion, that the benefit risk, if you look at it, the benefits way far, far, far greater than any potential. I think most of the safety concerns are reactogenicity. Whenever you inject any vaccine in the muscle, you will see something like this. Almost all vaccines do something like this.
And specifically right now, we're talking about the Pfizer vaccine. There have been some reports of people having issues with allergies. What do you know about that, and how concerned should we be?
I think that's a very good point. And the allergic reactions are largely related to your body's overreaction to certain foreign, okay? So sometimes it produces an IgE type antibody, and then you can get urticaria, you get shy, you get little, cough, sometimes you get, what I call it, angioedema, and that can be, if it becomes really severe when you have really anaphylactic reaction, just like people get with the peanut allergies or bites, bee bites and some of that. But none of that. Actually, the allergic reaction these two folks in UK they were mostly related to very mild, what I call it, allergic reaction. And they already had allergic reaction to other vaccines. So what happens is that once you develop allergic reaction to certain vaccine, you tend to be a little bit more prone to allergic reaction to other vaccines. And honestly, I think it is possible that in the vaccine material, because the vaccine is formulated in lipid nanoparticles, okay, it's a nanomedicine-based vaccine, it's an mRNA-based vaccine, which basically creates a message for your body to produce a signal, a protein signal, and your body can start producing these helper T cells, and then you get antibody response, and then you get T cell responses. So in some cases, in some people, the responses could be very acute in terms of IgE-based antibody response and acute allergic reaction. So if you are known to, or if you know that you are allergic to vaccines before, I think you should not take it as a precaution.
Makes sense. What about if you're pregnant or you're trying to get pregnant? Are there groups out there who shouldn't take it right now?
I would suggest that since this vaccine was not tested in pregnant women or women who might like to get pregnant, and there's no data, we don't know what the long-term effects are on the fetus. they are still doing a study in animals to really see if there is any impact on the pregnancy or fetus or newborn.
Well, let me ask you this. In a lot of the studies, they compare the results to placebo. Can you tell us why that's important and it should provide us some level of confidence?
Placebo is very important because sometimes people feel better naturally and they say, you know what, maybe I'm getting something and I feel good. So placebo kind of neutralizes that blinding effect. Basically, in this way, you know whether your effects are real or not real. Okay. A placebo is more like a dummy pill. Okay. So if both groups, got the same kind of effect, then you don't know what your drug is doing versus your dummy pill is doing. So it's really important to do this in a blinded manner. So the people who got the dummy pill or the placebo, they didn't know that they're getting vaccine or not. And the other ones also didn't know that they were getting a vaccine or not. The only way they would have known it if they found the reaction. So if you really start seeing pain and fever, and you think, oh, I think I got the active vaccine, So I think this is very important for scientific research that you have a placebo-controlled double-blind trial. It's really important I'll say, for the truthfulness of your results of your trial.
Bottom line, many reasons to have faith in these vaccines.
Exactly, because it was not done in a biased way. It was done in very unbiased way. And the results were presented to thousands of people. And, US FDA is the gold standard in the world. They will not approve a drug which they see if this will cause any harm to anybody in US. Obviously it's a risk benefit thing, for everything we approve. But at the same time, they look at, out of, let's say 100 million people get it, what will be the percent? If it's like 0.00001% people might get allergic reaction to vaccine, you have to take your benefit thing, we lost 3,000 or 3,200 people a few days back. It's more than what we lost in 9/11. I mean, the death, number of people, and then you say, I got something that will prevent you from not getting the COVID-19 virus. Why would you not do that?
Absolutely. Dr. Dixit, thanks so much for your time today.
Thank you very much for this interview. Thank you.
And thank you for joining us for this edition of Vax Talks. I'm Brad Satin.